Assalamualaikum warahmatullahi wabarakatuh. Today I will present about review journal Dysmenorrhea. My name is Safira Amalina, student number 39. Description of dysmenorrhea. Dysmenorrhea, which is defined as painful menstruation, affects up to 50% to 90% of adolescent girls and women of reproductive age. Dysmenorrhea leads to decreased quality of life, absenteeism, and increased risk of depression and anxiety. Dysmenorrhea is typically described as cramping pain in the lower abdomen, beginning at the onset of menstrual flow and lasting 8 to 72 hours. Dysmenorrhea has two classifications. First is primary dysmenorrhea. Primary dysmenorrhea occurs in the absence of pelvic pathology. It is mediated by elevated prostaglandin and leukotriene levels, with inflammation causing uterine contractility and cramping pain. The second is secondary dysmenorrhea. Secondary dysmenorrhea is due to pelvic pathology or a recognized medical condition and accounts for about 10% of cases of dysmenorrhea. Risk factors. Nulliparity, premenstrual syndrome, and a history of pelvic inflammatory disease are also associated with the disorder. Protective factors include increasing age, increasing parity, exercise, and oral contraceptive use. Primary dysmenorrhea, the risk factor is age younger than 30 years old, body mass index less than 20 kg per meter square, smoking, earlier menarche, younger than 12 years old, longer menstrual cycles, heavy menstrual flow, and history of sexual abuse. In secondary dysmenorrhea, the risk factor is associated with infertility, especially when caused by endometriosis. However, secondary dysmenorrhea associated with increasing gravidity, parity, and body mass index, such as a cause other than endometriosis. Clinical. Dysmenorrhea is typically described as cramping pain in the lower abdomen, beginning at the onset of menstrual flow and lasting 8 to 72 hours. It is often accompanied by nausea, vomiting, diarrhea, headache, muscle cramps, low back pain, fatigue, and in more severe cases, sleep disturbance. Symptoms more consistent with secondary dysmenorrhea include change in or progressive worsening of pelvic pain, abdominal uterine bleeding, vaginal discharge, and dyspareunia. Diagnosis. Evaluation should begin with a complete medical, gynecologic, menstrual, family, and surgical history. A pelvic examination is not necessary in patients presenting with symptoms consistent with primary dysmenorrhea. If symptoms consistent with secondary dysmenorrhea are reported, a pelvic examination should be complete and ultrasonography performed to assess for anatomic abnormalities or other pathology. Treatment. Treatment for dysmenorrhea are first, non-pharmacologic therapies like physical activity and exercise. Second is hormonal therapies. Progestin only oral contraceptive are an alternative for those who are not candidates for estrogen therapy. Third is NSAIDs or non-steroidal anti-inflammatory drugs. And the fourth is treatment resistance, like surgical options are available for patients whose symptoms do not improve with medical therapies. Conclusion. Dysmenorrhea is typically described as cramping pain in the lower abdomen, beginning at the onset of menstrual flow and lasting 8 to 72 hours. There are two types of dysmenorrhea, primary dysmenorrhea and secondary dysmenorrhea. Treatments for dysmenorrhea are non-pharmacological therapies, hormonal therapies, NSAIDs, and treatment resistance. This presentation is from Journal Dysmenorrhea by McKenna A. Catherine and Fogelman D. Corey, 2021. The title is Dysmenorrhea, American Family, Berisikan for 102, number 2. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh. Have a nice day.